Welcome, everyone, and thank you for joining us on this deep dive.
Glad to be here.
If you are here listening right now, you are likely someone who wants to, look past the surface level headlines. You want the shortcut to being truly well-informed without having to read a massive stack of medical textbooks.
Right, which nobody has the time for.
Exactly. And today, we have a very specific, incredibly detailed stack of sources that you provided for us to unpack. And when I say detailed, I mean we're getting into the absolute weeds of modern medical data today.
We really are.
We are looking at files sourced directly from the iMedix medical content engine. Specifically, we're looking at version 3.13.37.
And, it is a phenomenal resource, really.
Yeah.
For those who might not spend their weekends digging through pharmacological databases.
Like we do.
Like we do, yeah. iMedix is essentially an independent medical information platform. It operates as a massive drug database, but it also functions as an educational hub.
Right, so it's not just some sterile list of chemicals. It's a place where patients actually go to understand what is happening in their bodies.
Yeah.
You can read up on breaking medical news, dive into the pathology of different diseases, look up specific drugs, and there is even a community forum setting where people ask questions.
Which is exactly why we are focusing on it today.
Yeah.
Platforms like iMedix, they bridge a massive, often very intimidating gap.
Yeah, that gap between the doctor and the patient.
Exactly. You have high-level, peer-reviewed medical journals on one side, which are written in a language most people just don't speak. And on the other side, you have the everyday patient, a patient who just wants to know, what does this pill actually do?
What are the side effects?
Right. Is it safe for me to take this?
And the mission of our deep dive today is to answer exactly those kinds of questions about one very specific, highly controversial medication featured on the iMedix platform.
Yes.
We are going to look beyond the slick marketing, beyond the catchy cultural nicknames, and uncover the actual medical reality of a drug called Addyi.
Lady.
Now, you might not know it by that brand name, but you have almost certainly heard its colloquial nickname, which is the female Viagra.
The female Viagra.
Yeah.
It is a phrase that carries so much cultural weight,
Oh, that's
You see it in lifestyle magazines, you see it trending on online forums, and it is tossed around as if it's a simple, perfect equivalent to the male medication.
right.
But medically speaking, it is a term that is absolutely fraught with misunderstandings.
So our goal today is to tear down that illusion. We are going to separate the hardcore biological, pharmacological facts from what is essentially pink-washed marketing. We are going to look at the chemistry, the regulatory status, the very real and severe risks, and perhaps most interestingly, the human element.
The human element is huge here.
It really is the desperation and the psychology that drives the demand for this drug.
But, before we get into the mechanisms and the data, we really need to establish a very strict parameter for this conversation.
Yes, very important.
Both of us want to loudly echo the official disclaimer that is plastered across the iMedix platform itself. We are exploring educational safety information today.
Yes, absolutely nothing we discuss in this deep dive is intended to be medical advice. We are analyzing data.
Just the data.
This conversation does not in any way replace a professional medical consultation, a diagnosis, or a treatment plan from a qualified healthcare provider.
Please do not self-medicate based on a deep dive you listen to on the internet.
Cannot stress that enough.
It cannot be overstated. When dealing with complex health issues, especially things related to the cardiovascular system or sexual health, a licensed medical professional is the only safe path forward.
Exactly.
The body is an incredibly complex machine, and introducing unvetted chemicals into it without supervision is playing a very dangerous game.
Okay, let's unpack this. Because the deeper you look into this iMedix data, the wilder it gets.
It really does.
Let's start at the very beginning. What exactly is Addyi? Looking at the database categorization, it's listed as a branded generic pharmaceutical. It's an oral tablet. And the marketing, the marketing is aggressively targeted.
Very aggressive.
The packaging is pink, the pill itself is colored bright pink, and the name Addyi, it leaves zero ambiguity about who they are trying to sell this to.
Not at all.
But then I looked at the active ingredient.
And that active ingredient is the entire story here. The active chemical compound in Addyi is sildenafil citrate.
Okay, sildenafil citrate. For the listener who might not have a degree in pharmacology, what exactly is that?
Sildenafil citrate is the exact, precise, active component used in male erectile dysfunction medications.
Wait, you mean Viagra?
I mean Viagra, yes.
Wow.
There is absolutely no modification to the molecule. They haven't tweaked the chemistry to cater to female physiology. They haven't altered the compound to target different receptors. It is sildenafil citrate, full stop.
Okay, let me make sure I'm fully grasping this. We have a drug that was designed, clinically proven, and rigorously tested for male biology. And the manufacturers of this generic have essentially just dumped it into a vat of pink dye, stamped the word lady on the box, and decided to market it toward women who are experiencing sexual arousal issues.
That is precisely what the data indicates.
That's wild.
It is. And it brings up a fascinating point about the intersection of human psychology and pharmaceutical marketing. What's fascinating here is, why paint a pill pink?
Well, obviously, they are trying to signal to the consumer. Pink is culturally associated with femininity.
Right, but think about how powerful that subconscious signaling is. What's fascinating here is how a simple color change can attempt to rebrand a drug's entire perceived purpose without any change whatsoever to the actual science.
Yeah, the chemistry is identical.
Exactly. By coloring the tabard pink and using that specific language, the manufacturers are bypassing the logical brain and leveraging psychological cues.
They want you to trust it.
They want the consumer, in a moment of vulnerability, to look at that pill and subconsciously believe, oh, this was formulated specifically for me. This is for my body.
It is such a massive oversimplification of human biology. It's almost insulting, honestly.
It really is.
The assumption that repackaging a male drug with traditionally feminine branding somehow magically alters the pharmacokinetics to make it suitable, safe, or effective for women.
It is marketing driving the perception of medicine rather than science driving the medicine. And the reason it works,
It's the reason people buy it.
right, the reason we are even talking about it today is because it preys on a very real human vulnerability. When patients are looking for solutions to distressing, intimate personal health issues, they are often desperate.
Yeah, they just want help.
They are drawn to things that feel customized, things that offer a quick, specialized fix. The pink branding provides a completely false sense of security, but your vascular system does not care what color the pill is.
No, it does not.
Your liver doesn't care about the branding on the box. The body only responds to the chemical structure of the drug.
That becomes incredibly clear when you look at how iMedix actually categorizes this drug on their platform. They have a dedicated medication database section.
And looking at the files you provided, they list several FDA-approved medications, and they put a reassuring little green check mark next to them.
Yes, the approved list.
I'm looking at the list right now. You see drugs like Rybelsus, diflucan, amoxil, vibromycin.
All very standard.
Yeah, Cyclover, Zithromax, Proscar, and Levitra. These are names you might recognize from a standard pharmacy.
And those represent a very specific standard of care. That green check mark means those medications have undergone rigorous, multi-phase, multi-year clinical trials.
They've been vetted.
They have proven their safety and efficacy for specific populations and specific conditions to regulatory bodies.
Right. But then if you scroll down the iMedix page, right below that pristine approved list, there is a section labeled non-FDA-approved generics for reference only.
Yeah.
And this list is, well, it's a bit of a Wild West.
It is a completely different landscape, and it's crucial to understand who Lady Era's neighbors are on that list.
I'll read some of these off because the names alone sound like they belong in a spam folder, not a medicine cabinet. Go for it.
We have Camagra Jelly.
Yelly?
Yeah, Jelly. Vitalista, Fildina, Senforce, Suhagra, Tadashit, Salagra, Nizagra 100, Cialis Black.
Cialis Black.
What even is Cialis Black?
Yeah.
Then there's Tatapox, Ariacta, Prilogy, Viagra Super, female Viagra, and sitting right there, smack in the middle of this chaotic list, is Lady Era.
Yep.
And instead of a green check mark, it has a massive red X next to it denoting not approved.
Placing Lady Era in that exact context is one of the most valuable things the iMedix platform does for the consumer.
It really puts it in perspective.
Because when you isolate Lady Era on a website with soft lighting and promises of renewed romance, it looks like a legitimate treatment.
Sure.
But when you see it listed shoulder to shoulder with Camagra Jelly and Cialis Black, it completely strips away the veneer of that pink marketing.
It exposes it.
It reveals the drug for what it truly is, an unregulated, unapproved generic product operating entirely outside the boundaries of established medical safety protocols.
Okay, so we know what it is on the surface. We know it's just sildenafil in a pink costume. But to really understand why this is so problematic, we have to look under the hood.
We have to look at the mechanism.
Exactly. How does Lady Era How does sildenafil citrate actually work in the human body?
Medically speaking, sildenafil citrate is classified as a phosphodiesterase type 5 inhibitor. We usually just refer to it as a PDE5 inhibitor.
Okay, hold on. Phospho... What?
Phosphodiesterase.
Break that down for me because that sounds incredibly dense.
I know it sounds like alphabet soup.
Mm-hmm.
To understand it, we have to look at the vascular system, your
Yeah.
blood vessels.
Okay, blood vessels.
Your blood vessels have a layer of smooth muscle in their walls. When that muscle contracts, the vessel narrows and blood flow decreases.
Makes sense.
When that muscle relaxes, the vessel widens and blood flow increases.
Like opening up a valve on a hose.
Exactly like that. Now, in the body, there's a specific enzyme, PDE5, whose job is essentially to keep those smooth muscles contracted in certain areas of the body.
So it's the thing tightening the hose.
Right. And sildenafil is an inhibitor. It blocks that PDE5 enzyme from doing its job.
Got it.
By blocking the enzyme, the smooth muscles are forced to relax, which leads to a systemic dilation of blood vessels. It opens up the pipes.
So it is a vasodilator. It just forces the blood vessels to expand.
Yes. And the proposed mechanism for its use in women, the entire theory behind selling this pink pill, is that this systemic vasodilation will increase blood flow to the genital tissues during sexual stimulation.
Okay.
The thinking is that by mechanically increasing the physical engorgement of those local tissues, it may theoretically improve the physical sensations of arousal, perhaps aiding with issues like natural lubrication.
Well, wait, to play devil's advocate here. If a woman is experiencing distress specifically because her body isn't physically responding, wouldn't fixing the plumbing actually relieve that psychological distress?
You'd think so.
Right. If the pipes are open, doesn't that solve the problem? Why is the medical community so skeptical of this?
It is a logical leap to make, but it ignores a massive fundamental difference in how male and female sexual dysfunction typically present.
Okay, how so?
We have to draw a very bright, highly defined line between two entirely different concepts. Physical arousal, which is the plumbing, and sexual desire, which is your libido, your brain.
And the iMedix sources are incredibly explicit about this distinction.
They are. Lady Era only affects the plumbing. It only affects blood flow.
He doesn't touch the brain.
The medication does not and chemically cannot create sexual desire. It does not address psychological factors. It has absolutely zero effect on brain chemistry, emotional interest, or libido.
Imagine you're trying to start a car with a dead battery, and your solution is to change the tires.
That's a great way to put it.
That's what taking a blood flow pill for a brain chemistry issue is like. You are applying a purely mechanical fix to a problem that originates in the engine control unit.
That is a phenomenal analogy. In men, erectile dysfunction is very often purely a mechanical issue.
The battery is fine, the tires are just flat.
Exactly. The desire is there, the brain is sending the signals, but the physical mechanism of vasodilation is impaired due to age, vascular disease, or nerve damage. Sildenafil steps in and fixes that mechanical block.
But for women,
For women, female sexual dysfunction is frequently incredibly multifaceted. It heavily involves psychological components, emotional states, complex hormonal balances, and relational dynamics alongside the physical.
it's just a completely different system.
It is. If a woman is experiencing low sexual desire because of chronic stress, exhaustion, a severe hormonal imbalance, or a deep disconnect in her relationship, pushing more blood to her peripheral tissues is not going to magically resolve the core issue.
It's just treating a symptom.
It is treating a potential downstream symptom while completely ignoring the upstream cause.
And to really illustrate this difference, the iMedix text actually points out that there are legitimate FDA-approved medications for low sexual desire in women.
Yes, there are.
They mention drugs like Addyi, which is the brand name for flibanserin, and Vyleesi.
And looking at how those approved drugs work highlights the difference beautifully. Addyi and Vyleesi do not work on blood vessels.
They're not vasodilators.
They are not vasodilators. They target the central nervous system.
Yeah.
They interact with neurological and hormonal pathways in the brain.
Okay, so they work on the battery.
They work on neurotransmitters like serotonin and dopamine, which are the chemicals intrinsically linked to mood, anticipation, reward, and desire.
So they are actually trying to recharge the dead battery, whereas Lady Era is just pumping up the tires and hoping the car starts.
Precisely. They are attempting to address the origin of the desire, not just the mechanical aftermath of it.
Which leads right into the harsh reality of how this drug is regulated. We've established what Lady Era is, and we know sildenafil is approved for men.
For men, yes.
But the files make it crystal clear. The use of sildenafil for female sexual arousal disorder is entirely off-label and strictly unapproved by major health authorities.
Both the FDA and the EMA.
Right, the FDA in the United States and the EMA, the European Medicines Agency.
We really need to spend a moment defining what off-label actually means in a medical context. Because to the average person, off-label sounds somewhat benign.
It sounds like a life hack.
Exactly. It sounds like buying an off-brand cereal at the grocery store, or using a dish soap to wash your car. It sounds clever, but in pharmacology it carries incredibly heavy implications.
Right, because doctors can legally prescribe medications off-label, can't they?
They can. Off-label simply means that a physician is prescribing a medication for a condition, a demographic, or in a dosage that has not been specifically evaluated and officially approved by a regulatory body for that exact use.
So they're using their own judgment.
Physicians do this when they use their clinical judgment to determine that a drug might help a patient, even if it wasn't specifically designed for that exact scenario.
But while they can legally do it, stepping into off-label territory means they are stepping outside the protective umbrella of massive, structured clinical data.
Exactly. When a drug is approved by the FDA or the EMA, it is not just a rubber stamp.
It's a massive process.
It means the pharmaceutical manufacturer has conducted extensive, highly regulated, multi-phase clinical trials. We're talking about testing on thousands of specific patients over several years.
Phase 1, Phase 2, Phase 3 trials.
Through that massive data collection, they have established a definitive, reliable safety profile. They know exactly what the optimal dosage is. They have tracked the long-term effects on the liver, the kidneys, the heart.
And for sildenafil use in women, those trials just don't exist.
They do not exist in the comprehensive way required for approval. The safety profile for women taking this systemic vasodilator has not been definitively established.
Wow.
The optimal dosage for female physiology is completely unknown. And the long-term effects of women using this specific mechanism for sexual arousal are completely unverified by large-scale data.
I mean, the iMedix text actually states that the clinical evidence supporting the consistent effectiveness of sildenafil for female sexual arousal disorders is limited and inconclusive. So not only is the safety profile missing, but there isn't even concrete, undeniable proof that it works consistently for the very thing it is being sold to do.
Right.
Why on earth would anyone take that risk?
This raises an important question. Why do patients seek out experimental, unapproved treatments when comprehensive regulatory reviews do not support them?
I think it comes down to a feeling of total desperation and a lack of easily accessible alternatives.
Absolutely.
If you are struggling with something as intimate, frustrating, and emotionally painful as sexual dysfunction, and you feel ignored by standard medicine, and then you see a pink pill online promising a quick fix, I mean, it is incredibly tempting to bypass the red tape. You just want relief.
It is deeply understandable from a human perspective. We all want a simple solution to complex pain. But it is our job looking at this data to point out the scientific reality.
The reality is it's risky.
The regulatory bodies aren't withholding approval just to be difficult or bureaucratic. They are withholding approval because the data does not prove that the benefits outweigh the risks for this specific demographic.
And I want to remind you, the listener, that generic medicines themselves are not the enemy here.
No, generics are great.
In fact, within the iMedix database, they actually link to an educational article called Generic Medicines Explained: Why You Shouldn't Fear the Cheaper Option. Generics are a vital part of affordable healthcare.
They absolutely are.
But generic medicines that are marketed and sold for completely unapproved uses carry massive, sometimes life-altering unknowns. You aren't just taking a cheaper version of a safe drug. You are taking a drug in a way that science hasn't fully vetted.
And nowhere is that lack of scientific vetting more apparent and more dangerous than in the dosage. Which brings us to a particularly alarming aspect of the Lady Era product.
Yes, let's talk about the dosage and the overdose risks, because this genuinely shocked me.
It's alarming.
Looking at the usage instructions for Lady Era, it says you are supposed to take it 30 to 60 minutes before anticipated activity. It requires sexual stimulation to work, and the effects can last for 4 to 6 hours.
Okay, standard so far.
But here's the ticker. Lady Era is sold exclusively as a 100 milligram tablet.
That dosage figure is deeply concerning to any medical professional looking at this product.
Why is 100 milligrams so bad?
To give you some necessary context, let's look at how this drug is used when it is approved. When sildenafil is prescribed to men for erectile dysfunction, standard medical practice is to start the patient on a much lower dose.
What's the starting dose usually?
A doctor will typically prescribe 25 milligrams. or perhaps 50 milligrams.
Right, you don't just jump to the maximum. You start low to assess tolerance. You want to see how the patient's blood pressure reacts, how their liver processes it, how their body handles the vasodilation.
Exactly. It's called titrating the dose. You find the lowest possible dose that achieves the desired effect to minimize the side effects.
Makes total sense.
100 milligrams is the absolute maximum single dose recommended for a fully grown male patient. It is the ceiling.
The absolute ceiling.
And yet, Lady Era, marketed toward women, is seemingly only available at this maximum sledgehammer strength.
I couldn't believe it when I read that. We are talking about the sheer danger of a first-time female user taking the maximum male dose of a very powerful cardiovascular drug.
With no doctor present.
Without a doctor to say, hey, let's start you on 25 milligrams and monitor your heart rate, a woman buys this pink pill online, takes the 100 milligrams, and suddenly her vascular system is dealing with an immense, sudden, massive dilation.
The physiological shock to the system can be profound. We have to remember basic biological averages here.
Right.
Women, generally speaking, have lower overall body mass, lower blood volume, and different cardiovascular baselines than men.
So the drug hits harder.
Hitting that smaller system with a 100 milligram dose of sildenafil without any prior medical screening is, frankly, medically reckless.
The iMedix files provide a very explicit overdose warning regarding this. They state emphatically that you must never take more than 100 milligram pill in a 24-hour period.
Never.
And they note something very important that I think people misunderstand about medication. Exceeding this dose does not increase the benefits.
It doesn't make it work better.
Taking 200 milligrams won't make the drug work better if 100 milligrams didn't work. It just drastically spikes the toxicity and the risk of severe side effects.
And those risks are not trivial. When you overdose on a vasodilator, or even just take a dose that is too high for your specific body mass, you risk severe hypotension.
Which is dangerously low blood pressure.
Exactly. The blood vessels open too wide and the pressure plummets.
The pipes are too open.
This can lead to profound dizziness, fainting, loss of consciousness, and in severe cases, inadequate blood supply to vital organs, including the brain and the heart.
Wow.
It also severely increases the risk of the other systemic side effects we need to discuss.
Let's get right into those side effects then, because the cascading effects of this drug go from nuisance to absolute emergency very quickly.
Yes, they do.
Because the drug is systemic, meaning once you swallow it, it goes through your entire bloodstream. It doesn't just magically target the genital area. The side effects mirror those seen in men.
Same chemical, same side effects.
The iMedix source lists the common ones: headache, facial flushing, nasal congestion, indigestion or upset stomach, dizziness, and even back pain or muscle aches.
Let's break down exactly why those specific nuisance side effects happen, so the mechanical reality of the drug is clear.
Okay, let's take the headache first.
The headache and the facial flushing, that feeling of redness and heat in the face, those are direct physical results of the blood vessels in your head and face expanding rapidly.
So the headache isn't an allergic reaction. It's literally the pressure of your blood vessels swelling inside your skull.
Yes.
That sounds incredibly uncomfortable. And what about the nasal congestion?
That occurs because the tiny blood vessels in your nasal passages engorge with blood. When they swell, they physically narrow the airway, making you feel stuffed up.
Okay, and the dizziness?
The dizziness is a mild manifestation of your overall blood pressure dropping as the vascular system widens.
Right, and indigestion. Why would a blood flow pill cause a stomachache?
That happens because PDE5 enzymes are also present in the smooth muscle of the gastrointestinal tract. So inhibiting them can relax the esophageal sphincter, causing acid reflux.
It makes perfect mechanical sense when you explain it like that. The drug is doing exactly what it was designed to do, relaxing smooth muscle and opening blood vessels, but it's doing it everywhere in the body, not just where the user wants it to.
Exactly. It's not targeted.
But then the iMedix documentation transitions from these mild annoyances to severe emergency adverse reactions. And here's where it gets really interesting.
Or terrifying.
Yeah, terrifying is a better word.
The severe reactions require immediate emergency medical attention. Let's categorize them. First, there is the risk of a condition called priapism.
I feel like people have heard that word on TV commercials.
In men, this is relatively well known, often joked about in commercials as an erection lasting more than 4 hours. But we must translate what this physiological event means for a female user taking Lady Era.
Yes, the source specifically notes that painful, prolonged genital engorgement lasting more than 4 hours is possible for women as well. What does that actually mean for the tissue?
The clitoral and surrounding vestibular tissues are highly vascular, much like male anatomy. If the sildenafil traps blood in those tissues and the engorgement will not subside after sexual stimulation ends, it becomes incredibly painful.
So the blood is just stuck there.
But more importantly, if the blood is trapped, it is no longer circulating. It becomes deoxygenated. If this lasts for hours, the tissues become hypoxic. They begin to suffocate.
Oh my God.
This requires emergency room treatment. A doctor must intervene to safely drain the blood and restore normal circulation to prevent permanent, irreversible tissue damage and scarring.
Permanent tissue damage from a pill taken to enhance a Friday night. That is a horrifying prospect.
It really is.
And it doesn't stop there. The files also warn about profound sensory loss.
Yes, there are documented risks of sudden loss of vision in one or both eyes. This is related to a condition called non-arteritic anterior ischemic optic neuropathy, or NAIN.
NAION.
Okay.
Essentially, the sudden change in blood pressure disrupts the blood flow to the optic nerve, causing an ischemic event, a microstroke in the eye.
So you could go blind.
It is rare, but it is a documented severe risk. There is also the risk of sudden decrease or total loss of hearing, which is often accompanied by intense dizziness and tinnitus.
Tinnitus is a ringing in the ears.
A severe, persistent ringing in the ears.
I want you, the listener, to really pause and think about this for a second. You purchase a brightly colored pink pill off an unregulated website hoping to relieve some intimacy issues, and you could wake up with permanent hearing loss, blindness in one eye, or suffocating tissue damage.
The risk profile is insane.
The disparity between the gentle pink marketing promise and the hardcore physiological risk is just staggering.
And we must also include the cardiac strain.
Right, the heart.
The files warn of signs of a serious heart problem during sexual activity, such as sudden chest pain, extreme dizziness, or nausea.
Because sexual activity raises your heart rate anyway. Sildenafil lowers your blood pressure, and sexual activity inherently increases your heart rate and cardiac demand. If a user has an underlying, perhaps entirely undiagnosed cardiac vulnerability, that combination of low pressure and high cardiac demand can trigger a critical, life-threatening cardiac event.
Which perfectly transitions us to the next massive issue. The side effects alone are scary, but when you introduce other substances into the mix, Lady Era becomes a literal minefield.
A minefield of interactions.
The iMedix sources highlight some extreme drug and food interactions that every single person needs to be aware of. Let's spend some substantial time on what they call the absolute contraindications.
In medical terminology, an absolute contraindication means there is no gray area. Under no circumstances should these two substances be combined because the result is highly likely to be catastrophic, if not fatal.
The most critical one here involves a class of drugs called nitrates.
Yes.
The text mentions nitroglycerin, isosorbide, and recreational drugs known as poppers.
Nitrates are medications typically prescribed by cardiologists for chest pain or angina caused by heart disease. They are, in themselves, very potent vasodilators.
So you have two vasodilators at once.
If a patient takes a nitrate to manage their heart condition and then introduces a PDE5 inhibitor like sildenafil into their system, the two drugs violently compound each other's effect.
Oh boy.
The blood vessels dilate to an extreme, unnatural degree, causing a massive, precipitous drop in blood pressure.
We are talking about a total crash.
Yes. The cardiovascular system essentially collapses. The heart cannot pump enough blood to the brain or vital organs, leading to shock and potential death.
And I want to highlight the inclusion of recreational poppers here.
That's a huge danger.
Poppers are alkyl nitrites, often used in sexual or clubbing contexts to enhance sensation or relax muscles. Mixing Lady Era with a hit of poppers is an absolute recipe for a life-threatening medical emergency.
Completely unsupervised.
You are mixing two powerful vasodilators without any medical oversight. Then the files mention alpha blockers, like tamsulosin or doxycycline.
Alpha blockers are commonly used to treat high blood pressure or prostate enlargement in men, but they are also prescribed to women off-label for certain urinary retention issues or hypertension.
Okay, so they also lower blood pressure.
Like nitrates, they lower blood pressure. Combining them with a 100 milligram dose of sildenafil creates a severe additive blood pressure lowering effect.
So not a total collapse, but still bad.
While perhaps not instantly fatal like the nitrate interaction, it severely increases the risk of profound dizziness, fainting, and resulting trauma, like cracking your head open from a sudden fall.
Okay, now the text gets into some heavy pharmacological terms. They list potent CYP33A4 inhibitors,
Right.
and the specific drugs they list under this category are ketoconazole, ritonavir, and clarithromycin. I need an analogy here because potent CYP3A4 inhibitor means nothing to me.
Okay, think of the CYP3A4 enzyme like a bouncer at a very exclusive club, which is your bloodstream.
Okay, the bloodstream is the club. Got it.
The bouncer's job is to eventually kick the sildenafil out of the club when the party is over, metabolizing it so your body can clear it out and return to normal.
Okay, I'm with you. So the enzyme kicks the drug out.
Now, drugs like ketoconazole, which is an antifungal,
Yeah.
ritonavir, which is an HIV medication, or clarithromycin, an antibiotic, these drugs are inhibitors.
Okay, so what do they do to the bouncer?
Essentially, taking these drugs is like knocking the bouncer unconscious.
Ah, so the bouncer's out cold.
Exactly. The bouncer's gone. So the sildenafil enters your bloodstream, but the exit door is locked. There is nobody to clear it out.
Oh, wow. So the club just gets more and more packed.
The drug begins to accumulate in your blood, driving the concentration levels higher and higher. That standard 100 milligram dose can suddenly act like a massive toxic overdose, wildly spiking the risk of all those severe side effects we just discussed.
The blindness, the hearing loss, the severe hypotension.
Dose adjustment by a doctor is absolutely mandatory if someone is on these medications. But remember, Lady Era users are often bypassing doctors entirely.
That is a terrifying mechanism. And it's not just obscure prescription drugs. The iMedix files flag everyday items. Grapefruit juice is on the list.
Grapefruit juice is a classic CYP3A4 inhibitor.
Apparently, compounds in grapefruit juice can inhibit that same bouncer enzyme, essentially doing a milder version of what those heavy prescription drugs do, increasing the concentration of sildenafil in your blood.
Right.
And then, of course, there is alcohol.
Yes, the warning explicitly states to use extreme caution with alcohol. Alcohol itself acts as a mild vasodilator and can lower blood pressure.
So combining a few glasses of wine with sildenafil compounds the risk of hypotension, dizziness, and those debilitating pulsing headaches.
Furthermore, from a purely functional standpoint, alcohol is a central nervous system depressant. It dulls sensation and impairs sexual response.
So you take a dangerous, unapproved pill to help with intimacy, and then you drink alcohol, which counteracts the very mechanical benefit the pill was supposed to provide, while simultaneously doubling your risk of passing out.
It is completely counterproductive and highly dangerous.
If we connect this to the bigger picture, this extensive, terrifying list of interactions highlights exactly why a full, rigorous medical review by a doctor and a pharmacist is absolutely essential before anyone takes a systemic cardiovascular drug.
You can't just guess.
You cannot just guess what is safe to mix. You can't just assume your antifungal cream or your antibiotic won't react with a pink pill you bought online.
You absolutely cannot. Pharmacy is a complex, invisible web of chemical reactions. A trained physician or pharmacist has the expertise to look at your complete medication list, including supplements, diet, and lifestyle, and foresee these potentially deadly collisions.
And when you bypass them.
When patients self-medicate with unapproved drugs from the internet, they are walking onto a chemical minefield blindfolded.
And that danger is only amplified when we look at specific demographics. The iMedix source provides explicit safety advice for different groups, and is pretty unforgiving. Lady Era is completely unsafe for pregnancy.
Completely unsafe.
Its safety hasn't been established, it hasn't been tested, so pregnant women must not use it. It is unsafe for breastfeeding, as it is unknown if the chemical passes into breast milk and what it would do to an infant's vascular system.
Right.
And it is completely unsafe for anyone under 18.
The files also note that elderly users require a mandatory medical assessment because older adults often process and metabolize drugs much more slowly.
Liver and kidney function naturally decline with age.
Exactly. This leads to higher blood levels of the drug and drastically increased risks of side effects. Standard medical practice dictates a much lower starting dose for elderly patients, but as we established, Lady Era only comes in that massive 100 milligram hammer.
There are even warnings about driving and operating heavy machinery because of the potential for sudden dizziness, blurred vision, or fainting.
Yeah, that's standard for blood pressure drops.
But beyond these specific group warnings, the iMedix text outlines a massive systemic hidden danger that I think might be the most important concept in this entire deep dive. They talk about the masking effect.
Yes. The concept of masking is crucial for anyone listening to understand. In medicine, a symptom is rarely just an annoyance. A symptom is a signal. It is your body communicating.
It's trying to tell you something is wrong.
Sexual dysfunction, whether in men or women, is very often not an isolated, standalone problem. It is frequently an early warning siren for severe, underlying systemic health issues.
The text lists them out. Heart disease, hypertension, diabetes, hormonal imbalances, or severe psychological distress. How does sexual dysfunction signal heart disease?
Let's consider the mechanics again. For sexual arousal to occur properly, the body requires incredibly healthy, flexible blood vessels, healthy responsive nerves, and a balanced endocrine system.
Okay, all three systems have to work.
The blood vessels in the genital region are very small and very delicate. If those tiny blood vessels are failing to dilate properly, if they're stiff or clogged, it is highly, highly probable that the larger blood vessels in the heart, the brain, or the kidneys are also compromised.
Endothelial dysfunction.
Exactly. Sexual dysfunction is often the very first visible symptom of advancing cardiovascular disease or unmanaged destructive diabetes. The tiny vessels fail first.
So it's like a canary in a coal mine.
This symptom can sometimes precede a major catastrophic event, like a heart attack or a stroke, by years.
This is where self-medicating becomes genuinely terrifying. By taking a black market pink pill to force the blood vessels open locally, a patient might successfully achieve their goal for the evening.
They might mask the symptom.
But they are completely ignoring the siren.
It is the equivalent of taking the batteries out of your smoke detector because the noise is bothering you, while your kitchen is on fire.
Oh, it's a brilliant way to put it.
If a woman uses Lady Era to bypass arousal difficulties that are actually being caused by undiagnosed hypertension or advancing diabetes, she might delay seeking proper medical diagnosis and management for years.
Because she thinks she fixed the problem.
By the time the underlying condition becomes impossible to ignore, it may have caused irreversible damage to her heart or kidneys.
You are trading a crucial, life-saving diagnostic window for a temporary mechanical fix. And it begs the question, where are people even getting this temporary fix?
They aren't getting it at Walgreens.
Right. Legitimate pharmacies aren't stocking Lady Era next to the aspirin. That brings us to the shadowy world of the online black market and counterfeits.
This is a major, heavily emphasized concern highlighted by the iMedix platform. Because Lady Era is completely unapproved for women, legitimate, conscientious, board-certified doctors are highly unlikely to prescribe it.
A good doctor will not prescribe a 100 milligram unvetted vasodilator.
Therefore, patients who want it are driven out of the clinic and onto the internet.
The text states that purchasing Lady Era online without a prescription bypasses crucial medical screening, which we've established is dangerous. But it also invites staggering counterfeit risks. I mean, we are talking about buying drugs from websites that might disappear tomorrow.
When you buy medication from an unverified, unregulated online source, you have absolutely zero guarantee of what you are actually receiving in the mail.
It could be anything.
The iMedix files warn that these counterfeit pills may contain absolutely zero active ingredients.
Meaning you are essentially paying for pink chalk.
Exactly. Which is a financial scam and emotionally devastating for someone seeking help. But from a purely medical standpoint, pink chalk is almost the best case scenario compared to the alternatives.
Right, because if it's not chalk, it could be something much worse.
The alternatives are deadly. The counterfeiters might double or triple the dose of sildenafil without disclosing it because they have zero quality control, drastically increasing the risk of a fatal overdose.
Because they're just making it in a warehouse somewhere.
Or, perhaps most terrifyingly, the pills may contain toxic contaminants. Counterfeit drug labs do not adhere to FDA sanitation standards. They aren't clean rooms.
So what ends up in the pills?
Regulatory testing of seized counterfeit drugs regularly finds them contaminated with heavy metals, industrial solvents, rat poison, and other harmful adulterants.
Rat poison. In a pill someone is taking for intimacy. It is a really dark reality.
It's extremely dangerous.
The desperation for a cure for intimate, distressing problems makes consumers incredibly vulnerable. They want a solution so badly, they feel so unseen by traditional medicine, that they are willing to trust an anonymous, unregulated website selling an unapproved pink pill.
It happens every day.
And the black market pharmacy space preys directly, ruthlessly on that vulnerability.
It perfectly illustrates the dangerous intersection of human psychology, medical desperation, and unregulated commerce. The consumer is looking for hope, and the black market provides a beautifully packaged, highly dangerous illusion of a solution.
Let's explore that human psychology a bit more because the iMedix files actually give us a window into it.
The community aspects.
Yeah, one of the unique and frankly fascinating things about the iMedix platform is that it features user reviews and community discussions. It's not just a sterile database, it's a living community.
Right.
On the Lady Era page, there is one featured user review from a profile named Lepexa.
Analyzing user-generated content in a medical context is always revealing. It shows us how the medication is perceived, rationalized, and utilized in the real world outside of clinical settings.
Let's break down Lopex's review word for word. The profile indicates she is a beginner user with 213 points on the platform, and she posted this recently on May 28, 2025.
Okay, let's hear it.
She writes, "Figured I'd share my experience with Lady Era since I know a few people have asked. Honestly, I was a bit nervous to try it, but my doctor thought it might help."
Her doctor thought it might help.
We'll come back to that. She continues. "The first time I did get a bit of a headache, but it wasn't too bad and didn't last long, and I haven't had it since.
Right.
For me, it's just made things feel easier. Like I can actually get out of my head and just enjoy the moment more. It's been a nice little discovery, really."
There's an immense amount to unpack in that short paragraph.
Yeah.
It is a masterclass in the psychology of self-medication.
Let's start with the physiological reality she reports. She mentions getting a headache the first time.
As we discussed extensively, a headache is a classic, direct, mechanical side effect of sildenafil-induced vasodilation in the cranial blood vessels.
So it's doing something.
That single detail tells us she is indeed ingesting a biologically active substance that is forcibly altering her vascular system. It wasn't just pink chalk.
But then she says, "My doctor thought it might help." This is fascinating, given that we just established it's unapproved and highly discouraged.
Very discouraged.
Perhaps she found a doctor willing to prescribe off-label. Or, and this happens often, perhaps my doctor thought it might help is a rationalization. Maybe her doctor said, well, off-label sildenafil has been discussed in some literature, and she took that as a green light to buy Lady Era online.
It's impossible to know her exact clinical interaction, but the most clinically fascinating part of her review is her description of the actual benefits she experienced.
Yeah, let's look at that.
She doesn't talk about physical engorgement. She says it made things feel easier and helped her get out of her head and just enjoy the moment more.
And this requires intense dissection, because based on everything you've explained about the chemistry of this drug, that outcome shouldn't be possible.
We established unequivocally that sildenafil is a PDE5 inhibitor. It works on the smooth muscle of blood vessels.
Just the plumbing.
It does not cross the blood-brain barrier to alter neurotransmitters. It does not chemically calm anxiety. It does not interact with the cognitive loops or the psychological state of being in your head.
So if the chemical cannot physically, biologically alter her brain chemistry to reduce her anxiety, what is actually happening here? Why is she feeling better?
What we are highly likely observing here is a profound, incredibly powerful manifestation of the placebo effect.
A placebo effect.
And I want to be clear, the placebo effect is not just faking it. It is not an insult. It is a very real, measurable, psychological, and physiological response to the act of receiving an intervention.
So simply the act of taking a pill that she explicitly believes is a female Viagra designed to help her, provides genuine psychological relief.
Precisely. If her primary barrier to arousal was performance anxiety, stress, or, as she perfectly described it, being stuck in her head, the physical ritual of taking the medication essentially gave her psychological permission to relax.
She let her guard down.
The pill served as a cognitive crutch. She outsourced her anxiety to the pink tablet. She told herself, I took the pill, so my body will handle it now.
Wow.
The relief she feels is real. The relaxation is real. But it is being generated entirely by her own psychology, not by the sildenafil molecule.
That is absolutely mind-blowing. She took a powerful cardiovascular drug, exposed herself to severe overdose risks, potential blindness, and a minefield of drug interactions, all to achieve a psychological relaxation that the drug itself is chemically incapable of providing.
It perfectly highlights the insidious danger we've been discussing. She achieved a positive result through a psychological placebo, but she exposed herself to the entirely real biological risks of systemic vasodilation, interaction minefields, and potentially counterfeit sourcing to get there.
It is an incredibly dangerous way to treat anxiety.
It really is.
And when you pull back and look at the wider iMedix community context presented in the source files, it paints a broader picture of people genuinely searching for complex answers.
Yes, the community pages.
Beside Lopex's review, we see trending questions from other users. A user named Covum11 with 298 points is asking questions. We see a user named Pocase explicitly asking, what strategies help reduce anxiety naturally?
Which is a great question to ask.
And another user, Alex Gale, actively participating in discussions. We see trending community tags like alternative therapies, mental health, hormone health, and gut health.
The community data is vital because it shows that these are real people looking for holistic, multifaceted health answers in a very confusing, often overwhelming digital age.
They aren't just looking for quick fixes.
No, they are asking deep questions about anxiety, nutrition, and hormones. It shows that they recognize health is complex.
They're trying to navigate a broken system.
Exactly. And the tragedy of Lady Era is that it injects a simplistic, dangerous, purely mechanical fix into a community that is clearly struggling with complex, interwoven physical and emotional health issues.
It offers a hammer to a group of people who are trying to untangle a very delicate knot.
Which brings us to the synthesis of everything we've uncovered today.
Yes, let's synthesize this. We started this deep dive looking at a simple pink pill called Lady Era, aggressively marketed as the long-awaited female Viagra.
And through the data, we have discovered that it is anything but a miracle cure for low desire.
Far from it.
The medical reality, stripped of its pink branding, is that Lady Era is a maximum dose, unapproved male drug. It relies on a blunt, mechanical vasodilation process that fundamentally does not address the complexities of female sexual desire, emotional state, or brain chemistry.
We've seen that it carries life-threatening risks ranging from suffocating permanent tissue damage to fatal drops in blood pressure when unknowingly combined with common medications like nitrates.
And we've explored the terrifying dangers of the masking effect, where a generic pill hides the warning signs of serious underlying diseases like diabetes or heart conditions.
And we've walked through the precarious, unregulated nature of buying these generics on the online black market, where you might be buying toxic contaminants.
The overarching takeaway from analyzing these iMedix files must be a reiteration of the necessity of seeking specialized medical care.
Yes.
If you are experiencing distressing sexual health issues, the answer is not an unapproved internet pill. The safest, most effective path forward is consulting with specialists, gynecologists, endocrinologists, or sexual medicine therapists.
They have the tools to actually provide a proper diagnosis.
They can explore hormonal therapies, offer psychological support, or prescribe FDA-approved medications that actually target the neurological pathways of desire safely.
So what does this all mean for you, the listener? It means we must continually look past the color of the pill. We must look past the aggressive marketing, the colloquial nicknames, and the promising packaging.
We have to read the science.
Understand the chemistry and respect the regulatory safeguards that are ultimately designed to protect our lives.
Knowledge, patience, and critical thinking are our absolute best defenses against a medical marketing machine that often outpaces scientific reality.
Exactly. I want to leave you with a final provocative thought to ponder as we wrap up this deep dive into the iMedix files. We have spent this time discussing the intricate, multifaceted, beautifully complex nature of human biology and psychology.
It is incredibly complex.
If human sexuality is so deeply intertwined with our emotions, our relationships, our daily stress levels, and our unique brain chemistry, why is our culture so dangerously, persistently obsessed with trying to fix it with a single, brightly colored pill?
That is the big question.
Thank you for joining us on this deep dive. Keep asking questions, keep reading the data, and always look beneath the surface.